What is isolation? Have you ever wondered how societies manage the spread of infectious diseases? One important method is isolation, a practice that has been around for centuries. So, what exactly does isolation mean in the context of disease outbreak response, medical anthropology, and global health? Let's break it down. Isolation refers to the intentional separation of individuals who are infected with a communicable disease from those who are healthy. This practice aims to stop the spread of infections by keeping sick individuals away from others until they are no longer contagious. It is different from quarantine, which restricts the movement of people who may have been exposed to a disease but are not confirmed to be infected. Historically, isolation has deep roots. It can be traced back to ancient texts, including the Bible, where people with infections were instructed to separate themselves. During major epidemics, like the Black Death in the medieval period, isolation was used on a large scale to protect communities. In the 19th century, specialized hospitals were built to isolate patients and control outbreaks effectively. In modern medical anthropology, isolation is viewed as more than just a medical procedure. It is also a social and cultural practice that influences individuals and communities. The way isolation is implemented can affect social relationships, mental health, and community dynamics. For instance, when isolation lasts for a long time or is enforced without support, it can lead to feelings of loneliness and social disconnection. Today, isolation is carried out in healthcare settings. Infected patients are cared for in dedicated spaces or units, ensuring they do not come into contact with healthy individuals. A related practice is cohorting, where patients infected with the same pathogen are grouped together. This helps minimize the risk of cross-infection. These methods are essential in managing outbreaks of resistant microorganisms and emerging infectious diseases. From a global health perspective, isolation is a key part of disease outbreak response strategies. It helps contain infections and protects public health. However, it is important to consider the social consequences of isolation. Social isolation and loneliness can have significant health impacts themselves. Therefore, effective outbreak response should balance infection control with attention to the social and psychological well-being of those who are isolated. In summary, isolation is the separation of infected individuals to prevent the spread of disease. This practice has ancient origins and remains vital in today's public health efforts. Understanding isolation through the lens of medical anthropology allows us to appreciate its biomedical and social dimensions, which are crucial in global health initiatives.